can't sit by yourself and communicate, right? You need to have someone to receive. So we have a sender and we have a receiver, right? Okay, so this is communication. Skills. What's the meaning of communication skills? How to deal and how. So in this practice, this is a dental practice, we have doctors, we have nurses, right? And we have patients. Would you consider the doctor with another doctor, Dr. Asma and Dr. Ammar, when they communicate together, will it be the same as Dr. Ammar and Ibrahim when they communicate together, or Dr. Ammar and his patient when they communicate together? Will the way that we communicate, it will be the same? When Dr. Ammar talks to Dr. Asma or Dr. Hussein or Dr. Salim, they're talking because they're maybe talking dentist to dentist. Dentist to dentist, this is a sort of a communication, maybe terminologies, maybe technical words that they understand because they're on the same level of education. That's why they will be talking together in the same language. Yes. Right. So doctor to doctor, this is, we call it an intraprofessional communication. Doctor to patient or doctor to nurse, this is totally different. Why? Because there's doctors, they have a certain way of talking, they have certain knowledge, but the patient is not the same level of knowledge as the doctor. When we're talking about doctor to patient, we dealt this morning, this was part of our discussion this morning or part of the talk this morning, doctor-patient relationship. Now, this gathering that we're having here, it's the doctor-nurse relationship in the dental practice. From your points of view, now we have nurses and we have doctors. Doctors, what do you expect from the nurses in your communication? What do you want from them in the communication inside the dental clinic? Dr. Salim. This is what we were talking about maybe last time. I'm just giving you a preview. We dealt with what is communication, how we communicate, communication styles, and becoming good communicators. Now, Dr. Salim, you said to listen. Dr. Asma, what do you want from the nurse in the environment inside your clinic?
They should know my next step, what it would be without me telling.
Like that. So how will they know? With a facial expression, maybe like كده. You know, we have a famous singer, Kulthum. You've heard of her, maybe the guys you don't know Kulthum. She's the legend of all singing in the Arab world. Okay, when she was singing on the stage, she would just, you know, with her hand like that, the guys in the back would know that she's going to repeat the part of the song. So just with her body language, she doesn't have to do anything. She doesn't have to turn and say, again, please. No, she's just waving with her hand like that. Waving with her hand like that means that the orchestra behind her, they just stop and they repeat again because the crowd and the audience wants to hear this again, this part, because they are really happy with it, okay? So you expect them to know the next procedure without even telling them. How will they know this?
With training.
With training, they should be trained. So they should be trained. So listen, they should be trained. Dr. Ammar.
Aside from these two things, I think we need to be transparent between us and them. I mean, if there's something that's not right or something that went wrong, rather than trying to fix it on your own, speak up and maybe we can fix it faster, fix it more properly.
Very good issue. We will now, listening, know what you're supposed to do, when you're supposed to do it. And last but not least, you've done something wrong, say it. So we can speed up the policy instead of damaging and...
I can add something?
Yes, sure.
Also, other than listen, ask. Like, if I say do blah, 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 I don't know what's blah, blah, blah. Don't be shy to ask.
This is an issue. Let's turn to the nurses because they have to answer, respond, and say in return what they want from the doctor as a communication in the clinic. Let's start with, Mario. Yes.
What do you require from a doctor?
يعني,
Less IR.
yes, you're in the clinic. You're with who? Which doctor do you? Dr. Ammar. Okay, so you're in the clinic with Dr. Ammar. What do you? يعني, do you feel comfortable in the clinic with Dr. Ammar?
He's helping me out, honestly. He's helping me out.
I can't hear you. Raise your voice. Yeah.
He's helping me out.
Mhm.
He's teaching me also.
He's teaching you. Okay.
So far, I don't have issue now.
You don't have issues. You don't have issues. Okay. We'll return back to you again. Okay. Yes. Because I don't believe you don't have issues. I think you have lots of deep issues. Yes.
No,
Okay.
Because he served in all clinics, by the way.
Okay. Okay.
He served with me, with Dr. Asma, with Dr.
Okay.
Martin.
Okay. So, Jean. Yes, Jean. Yes. Yes. Please. Speak up. Hmm?
No, just
This is what we were saying. Dr. Ammar says, speak up. Say what you want to say, because we want to have a good environment. This is the dental clinic. It has to have a very healthy environment to promote and to create a healthy environment. People have to speak up. I don't know what's going on in your mind. I don't know you, okay? So I want to know you. How can I know you unless you speak up and tell me what's on your mind? So I will say, okay, I agree. No, I disagree. This is what we want. Speak up. Huh? So Jean is out. Ibrahim, let's turn to another male figure in the group.
Actually, this is new, my challenge.
Okay.
Because I'm an assistant nurse for medical. This dental
Oh,
is
so you?
new.
Yes.
Because this is a new challenge.
Mm-hmm. What's the difference? Okay, what's the difference between the medical and dental nurse?
Yes, big difference.
Mm-hmm.
Because medical deal or contact
With the patient.
ICU or OBD.
You
department.
actually you see the doctor randomly.
Yeah.
Maybe sometimes you might not even see him. You'll see a chart, and what's written in the chart, you do what's written in the chart. Okay? Yes.
But in dental,
You're in close proximity. You're in close proximity with the dentist. Actually, you're like this here.
yes,
يعني yes, a forehand technique. You're actually his other two hands.
Yeah,
He can't have four hands, so you are his other two hands that help him along the way, right? Mm-hmm.
In medical, doctor order medication or every procedure you will do by myself or with doctor.
Mhm.
But in dental, everything is different for me because I didn't know the name of instrument or material or technique, how to use suction, how to use everything in dental. Everything is good for me, is new for me.
Mm-hmm.
It is big my challenge, but I'm comfortable here
Mm-hmm.
because the trainer with me, Dr. Asma, it's a good trainer.
Yeah, she's very.
Actually, it's a good trainer. Everything noted here, she told me.
Mm-hmm.
She told me everything. She contact with me every time, every procedure. Told me how to technique the suction, how to contact with.
Very good.
Everything.
She's
she told
training
me.
you. This is what we were saying. She's training you so that next time, without even telling you, Ibrahim, you have to do this.
Yes.
You know that after she does so and so, you have to do this.
Yes. After doctor contact with me every procedure and told me everything, I think now it's comfortable for me. I'm happy and little mistake. I'm still
Learn.
Still
Yes,
learning,
yes.
Still learning. I'm not professional, but still learning.
Uh-huh.
And it's good for me because I like this field.
Okay.
Because before
It's a total
the
different.
nursing,
You changed totally. This is a total difference.
Like
This is
dentistry now.
yes. She likes dentistry now.
yeah,
Yes,
I,
yes.
I like before because before.
So you feel you have a duty and a task much
Yeah.
better than being a medical
much,
nurse.
Yeah, much,
Really?
Much better.
That's
much better.
okay.
Because this another field, but I like this more. I like this. It was
Very good.
It was
Yeah.
in my dream. In
Mhm.
my dream before.
You wanted to be a dentist?
Go to nursing. in my dream before.
Watch out.
Before go to medical.
Watch out.
Before go to nursing. I hope to join. I hope to join before going to medical. To nursing, to dentist.
Okay, okay.
So I think he feels more included.
Yes. You know, there's a field that's
But
called
Alexis,
dental
we-
hygienist.
Every
Come on, this is
meeting
not
I-
in our societies, dental hygienist, but in the United States, there is a profession. Is there?
Starting to apply.
Hygienist.
Yes, yes.
Hygienist?
A dental hygienist. Yes, yes, yes.
Just
I
an
don't.
exam, period exam.
Yes, 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 yes. And you can seek for that if you have an interest because you look like a challenging guy. Yes, yes. There will be a need. There will be a need in the future for the presence of a dental hygienist to take some tasks from the dentist, and so they won't have to do the part of the scaling and jobs like that. It would be your profession if you can do it. Yeah. Okay. So Dr. Salim said in the beginning, listen. This was a very, very. Why did you say that, Dr. Salim? This appears to be an issue with you. They don't listen?
Because
Ah.
the way you ask things,
Mhm.
sometimes you can just ask something complicated in a simple way,
Mhm.
so they will not get it, right?
Mhm.
For me, sometimes it happened to me before. I tell, please, I'm not asking you to know what's 1 plus 1. I'm just telling you, write 1 plus 1 equals 2. This is what I'm saying. Just write it, please.
Mhm. Mhm.
Go read the paper. 1 times
1 plus
3 equals.
Equals 4.
Yeah. So,
Yes. So there's a big issue.
why?
We are not listening to what we are being told to do. Why? He's asking the question. He's asking the question now. Why don't we listen? Why is listening a big issue?
So we're not focusing.
Why?
We're not focusing.
Focus.
You're not
He's not
focused.
focusing.
He's not focused. Yes, so we're not active listeners. If listening requires, and we have to be active listeners. We have to clean up our ears and listen properly, because listening is an issue in communication. Can communication be applicable without listening?
No.
So this is an issue. You have to be good listeners. Here we have Arabs and we have Philippines. You're Philippines, right? All of you from Philippines? Anyone outside Philippines? لا Arab. He's one of us. Mario, you're not.
One more nurse is there, but
Let's put an issue inside the dental clinic. Say we have a nurse, she's from the Philippines, and the patient is from Philippines also. And our doctor is not from Philippines. The patient talks in Filipino and you answer back. Is this right?
No.
Is this a good communication inside the dental clinic? Someone didn't answer. Someone is quiet and silent. Why are you silent?
Because he's the most vulnerable.
Why? Why are you silent? Because you are the one that's doing that. Now, the ones that responded immediately, they will not do that. You didn't respond because actually this might have happened with you. Now, my advice to you would be, if the patient from herself or himself found you because you are like from the same culture, and he feels safe and secure because you understand him, so he spoke in his language to you and you understand him. But we have our doctor. Now, he is the one responsible inside the clinic. He is the boss inside the clinic. We have to respect our doctor. You have to show the patient that you respect the doctor. by answering back to the patient, you are giving message to the doctor that you don't respect him. This is the first impression that he gets. He might like you and he says you're the best nurse, but this issue is very important, respect. So how can you change this? How can, without offending the patient? Because also patient satisfaction is necessary. We have a triangle here. It's a big issue. We don't want the patient to be offended that you're going to say, no, don't speak in English.
I will reply in English when
Excellent. That's
so
it.
that he will.
That's it. If he keeps saying in Filipino, you answer back in English. This way, the doctor knows that you are his right-hand man. This is number one. Number two, the patient eventually will understand that you are not allowed to talk in your native language inside the clinic. You are supposed to take the universal language inside the clinic, English. He respects you, he respects the doctor, he respects the clinic. Okay? The doctor might think you're talking about him. That's the first thing. If that happens, I will, believe it or not, we might be doing that as Arabs also. We might be talking about you. Who knows? But living in our countries, you might have caught up and understand some Arabic now. So you understand sometimes what we are saying. Okay? But vice versa doesn't occur. So in the clinic, we have to respect, listen. What else? What else? Respect and listen. What else? What do we need to do in our... What else? What else do we need to create in our environment?
Focus. Be prepared.
Focus, yes. Well, if you're a good listener, you'll focus. And also focus on what's going, step 2. Step 1 is kaza, step 2 is kaza, step 3. She doesn't have to tell you all the time, Ibrahim. She doesn't have to say, without you know. There should be like a body language between you two that you understand. If, like I told you, Kulthum, she used to raise her hand, so you know raising your right hand means suction. Raising her left hand means something from the table. Raising مش عارفة إيه, if she does like this, it means get a napkin. So each body language, so it's important to keep an eye contact. Listen, respect, and focus, eye contact with your doctor. Keep an eye contact to see what she's looking at you, telling you to do what next, okay? And
I have some word that includes many things actually.
yes?
Be professional.
Be professional. Okay. What's the duties of the nurse? Yes.
Behave professionally as a
Professional has 2 branches.
yeah.
Behavior
Yeah.
and duties. Our job description.
Talking behavior.
Behavior.
Yes.
Behavior. Emphasize on behavior, please. Tell me what you mean like behavior. Tell me like a bad behavior that you don't acknowledge.
Actually, one
Yes.
regarding the language and one even with the English. Like the language you say talking to the patient, but because now, for example, each clinic have more than one assistant. Sometimes they are talking together.
Yes, this is another issue. Believe it or not, this was.
I don't know what they're saying to each other.
Believe it or not, this is the same issue. This is the same issue, and I was told this. I was told this, that there were 2, and I was the doctor and the patient, and the 2 assistants, that the nurse and the assistant that's inside the clinic, they were talking with each other in their native language. This is a no-no. This is the don'ts. If we're going to do and the don'ts, the do's and the don'ts inside the clinic, don't speak in the native language at all. If it's your coffee break and you're downstairs and you want to, you can do whatever you want to do. But inside the clinic, you have non-native language professionals in the clinic. Do not speak other in English. It's very important. And this, as I told you, this gives us the impression that there is a respect in the, at the same time, there is no conflict between the doctor and the nurse or the patient. We don't want this. Tomorrow we'll be talking about conflicts and how we can resolve conflicts between, even in the environment that we're working in, okay?
This is a two-way. I mean, this applies to us too, I think, right?
Yes, definitely.
When Nabulsi walks into the clinic, do we speak to Nabulsi in English? I don't. Honestly, I speak to him in Arabic.
He's not supposed to step in the clinic while there's a patient.
That's
When there's a patient. Without the patient.
Something else.
this is another issue.
If two of them are speaking
This is
the
another
same
issue.
language.
We have our nurses now. When Dr. Ammar and Nabulsi are talking in Arabic, do you feel bad that they're not talking in English?
You're okay. It's okay to.
They don't care. They don't care. they understand your Arabic now. That's the problem. That's what I was talking about. They've been living here. They understand Arabic. Okay. They might not talk it like Dr. Asma says. I don't speak, but I can understand. Okay, but we don't understand your language. That's another. This is very difficult for us to learn now. Okay, so this is the issue. If you go freely, speak in Arabic, they understand it's an Arab country. Okay, they know that this is an Arab country. Okay.
With all respect,
yes.
sometimes the reverse is not nice, even in front of patients.
Yes, we were talking about that.
Yeah,
we said this. Yes, please tell us. Yes.
Yeah, when you are busy with some patient, something, especially when you have a problem, missing screw or something.
No, we were saying another example, Dr. Hussein. We said we said another issue, and no. One of our nurses didn't say a thing because she is doing that. We said if we have a Filipino patient and our nurse and the Filipino patient starts to speak in his native language with the nurse and she talks back, is this proper? They all said no, except one did not say. Why? Because she unfortunately she did it maybe once or twice, I don't know how many times. So we said, I asked her, how would we want to remedy this, and we want to put a treatment for this issue so that won't be done again. She said, we'll talk in English. She'll respond to the patient in English, making you understand that she's not allowed to speak in the native language inside the clinic. And this gives us a way that we respect each other and we create a friendly atmosphere. We want a friendly atmosphere, Gamal. We need to have this, a friendly, sociable atmosphere, no tension. This is very important. We don't want people to be tense. If you're tense and the nurse is tense, the patient will be tense. Yes, definitely. If he sees like this, oh my goodness, what are they doing? No. So take care. Creating a tension inside the clinic, you'll have an unsatisfied client. Your patient will be return back to the patient satisfaction. Patient satisfaction is the essential outcome of your presence inside the clinic. Doctor, nurse, the patient. This is a nice triangle. The communication within the three, if it's done right, we have patient satisfaction. And of course, we said this morning, the patient satisfaction equals حاجتين. What? His perception minus expectations. He's coming to the Vision Dental Center. He's heard on the social media, it's a wonderful, nice, friendly atmosphere. It's bright colors. It's warm. It's very nice, clean. Very important cleanliness, okay? And then he goes inside the clinic. And then he sees Dr. Ammar and maybe, I don't know, Mario. And then Mario, I'm a patient. Oh my goodness, there's a fight between them. They don't like each other. Oh my goodness, something's going to happen. I'm a very tense patient. I don't like dentists. I hate dentists. But I have a toothache. I haven't slept all night long. And both of these guys are going to be working on my teeth. Oh my goodness. One is on my right side and one is on my left side. Oh my God, they're going to kill me. So I won't be satisfied. But if I perceive and look, Dr. Ammar smiling and Mario pleasantly looking. Why are you looking like that? Give me a nice look. Give me a nice smile. Yes, nice greeting. Greet me as if you're happy to see me. Show me that you're happy to see me. You have to show me that you are happy to see me.
Morning.
Yes, I want to see that friendly face. Yes, Dr. Ammar. No?
He does have it, actually.
He does have it?
Yes.
He doesn't give it to me.
Otherwise,
Why doesn't he give me it? Show me some of that nice. Okay? If you give this, his perception, he had expectations. His expectations, your perception is way much more than his expectations, so he'll be satisfied. Okay? This is what we want to create, a good environment inside the clinic. So listen actively. When we say actively listen, we focus. Don't think what's going to happen at 8 o'clock tonight with so-and-so, or don't think I'm going to the movies, I'm going to see مش عارفة إيه tonight. No. Don't think I have to cook for my kids مش عارفة إيه. No. Don't think about anything. Focus as long as you're inside the clinic. Forget what's outside. Isolate yourself. Forget that you have a life outside this clinic. This clinic is your life. How do we do that? Enter clinic. When you go outside the door, remember all the debts you have, all the issues you have with your husband, your family, all the issues that you have, all the cleaning you have to do at home, all the laundry you have at home, everything. But when you get out of this door, inside here, forget about everything. Forget your mobiles. This is an issue. This is very crucial. It's very bad that you're working, Dr. Ammar is working, and Mario, and then ding! This is not allowed. No, put your mobiles, no tintin. فيش تنتنات وحاجات دي. No. Do you do that? Are they tantana? مفيش تنتنات?
My phone with tantan, but no one else.
So your mobile is also no tantan. What goes for them goes for you guys.
It's very annoying.
Yes. If I'm a patient under your hands, focus, doctor. I'm the patient. This time is for me. It's not for the mobile. Okay?
بس tantan. No one's looking at that.
Any sounds other than your voice and your assistant's voice and the patient's voice is unaccepted inside the clinic.
I do
Yes.
agree, doctor. Sometimes being I'm on a managerial level, I have to leave my phone, but not in my pocket in the office.
Yes.
And the nurse, she replies loudly, "Hello, sir, Dr. Tahoun is with patient." So I'm telling indirectly to my patient I'm important. Then kindly give me your details, and doctor will call you back. So I think it's a runaway of because some patients, VIP patients, or even governmental legal bodies, they call and they disappear.
Yes.
So I had to catch it, but I catch them in a way that I tell my patient, doctor is you are important for the patient. Doctor will not leave the telephone, but he will tell or will make someone
Yes.
do
Like
something.
what happened this morning, you had to get out because it's an important phone call. Yes. But sometimes, Dr. Hussein, I'm talking about other silly things that happen, like
social media,
yeah. Or yes, WhatsApp, Instagram, stories. Yes. These are, come on, this is not the issues. We're talking about the social things that you use for the mobiles. Okay. So we said active listening, focus, respect. Native language is a no-no. We all speak in the universal language inside the clinic, English. Okay. Assistants together don't speak except in English unless you're away, far away from the clinic. You can speak in any language you want. Okay. But in front, Dr. Salim, Dr. Asma, Dr. Hussein, Dr. Ammar, Dr. Amr, whoever is inside the clinics, please, we use only English language. Okay. Friendly faces, like this pyramid here, clinical proficiency. clinical proficiency, we have our clinicians. They are clinically efficient. They are competent. They practice dentistry. You are nurses. You have been trained or being trained by your doctors what to do first, next. So you're being trained. So as regards the clinical proficiency, it's established. Second, communication skills. This is what we mean. That means it's part of the pyramid that creates the keys to success. Success of what? Of this establishment, of this facility, of this clinic. Okay? This clinic to be successful, management. That's what Dr. Hussein is trying to do. We're trying to manage this establishment in order to create the success. If you see the middle part, if we remove it, management and clinical proficiency can't create a successful environment. To hold this building up, communication skills is essential. It's essential. Okay? Now, when there's conflict or tension between the dentist, it will be apparent to the patient. I told you that. I told you. The patient will be looking at your eyes, looking to focus and see the tone of your voice. Dr. Amar, I told you to get me suction. These notions, these behaviors of the doctor and the nurse will make the patient tense, unhappy, won't come back. Dr. Hussein won't be satisfied, won't be happy. Okay, what you told me in the end, the tip of the iceberg is ROI. Return over, yes, return. He said it.
Yeah, it's the same.
Yes.
That use the same triangle,
Yes,
different meaning.
yes, exactly. Of course, one of the main roles of a dental nurse is to ensure absolute and total cleanliness. Yes. Everything in its place. Before the patient enters, after the patient enters. The patient leaves the clinic. Doesn't mean that you go outside to the toilets or go eat something or go and chat with a friend or go and see your mobile to see who sent what and what. No, clean up. Always clean up your area. Environment inside the dental clinic, friendliness. We have to be friendly. Yes, create a friendly atmosphere. You have to create a friendly atmosphere. Why not? Why not be friends inside the clinic? Why not? What's the problem of being friends? Why not? Okay? Empathy. Be sympathetic with each other. We all have problems. Dr. Asma has problems, you have problems. But together we can be happy together. And like I said, we throw our problems outside the clinic until we get back to them in the afternoon or the evening. Yes, Dr. Aoun?
Actually, we had one time some lecture about this. With your colleague, you have to build a relationship, not a friendship.
Yes.
Because friendship actually,
yes,
it
destroys.
You will keep saying, nah, haram, I will not tell that he's not good because he's my friend, then you will destroy each other.
No, this is something else. Friendly atmosphere doesn't mean when someone does something wrong, you don't tell that Fulan did something wrong. No, this is another issue.
So good relationship, not a friendship.
A friendly atmosphere. We're talking about friendly atmosphere. Why friendly atmosphere? Because it gives us the impression that these people know what they're doing. These people are, they're nice. I like this environment. You'll find on the social media, Aljan will tell you, they have said that I went to Dr. Ammar and there was his nurse today and they were very nice. I felt at home. I felt at ease. These words, at home and at ease, make other people, when they look at the social media, this is a nice place, I'd like to go and be treated there because I like to feel at home. Where do you feel happy? Where do you feel safe? Where? Home. Definitely. You don't feel when you go to the bank you're safe, actually. You feel like a criminal sometimes. like if you're taking your money, it's like you're not allowed to take your money. You've put money and now you're taking it. No, don't take it. You're not allowed to take it. So this is not, you don't feel safe. Like in the only place you feel really happy is at home. Say, home sweet home. That's it. Yes, you feel, at last I'm home. At last. So let the patient also feel this word and say, I feel as if I was at home. How will he feel at his home? The people they create. Because believe it or not, if you're all outside this room, what will be left? What will be left if we all get out? Walls, floor, ceiling. Do they have emotions? Do they have feelings? Can they say something? So it's like a desert. But when we put people inside the room, it's like the sun rose, like the sun, it's sunny. Because people, they make warmth. Their bodies, they express warmth. So do that, okay? ماشي؟ خلاص؟ Efficiency, طبعا, being efficient, you have to show that you're efficient in your work. Don't let Dr. Ammar do like this so that you know that you're supposed to put the suction. Or you didn't change the cup, or you didn't do much. Don't let him do vigorous reactions with his hand because he doesn't want to speak up and say something in front of the patient. Don't let him do that, because eventually the patient is looking with his like this. I am a patient, I would do this. What are they doing? Okay. Punctuality. What's the meaning of punctuality? Be on time. Be on time. Respect time. Respect time. Respect each other and respect the time. Okay? This is very important. What do you think about this issue, Dr. Ammar? Punctuality. Do you have an issue with your nurses as regards punctuality?
Not just Mario, no one I work with had a problem with punctuality.
They're all punctual?
I mean, I come last, so
but
they're always
when
here
you
when I'm there.
when you enter the clinic, everything is in its place, ready to perform your task that you have. They know the patient is coming, and they know what they're going to be doing with the patient.
I'd be lying if I'd say everything is always ready in the morning, but sometimes yes, sometimes no.
Okay, so this is what we mean. Now you have a schedule. You know your patients that are coming today. You know what each one you're going to be doing. If it's a new patient, this is something else. Like, and if we have a patient that he's already returning for a procedure that you know what's going to be done, everything has to be put. Don't say, oh, I have to go to the lab and I have to do. No, don't do this, because this is time consuming. It's part of the schedule, the time that we have on your MySmile from 9 o'clock to 9:10 or 9:30. These 30 minutes, they're valuable. They're the patient's time. They're not to go out and get something and come back. So Dr. Ammar, when you enter, everything is ready for the patient?
80%.
80%. Dr. Asma? Dr. Salim? Okay, so this is it. You have to be punctual in reading your schedule. Look at the schedule. See, you have 9:30 an appointment. This appointment requires so and so and so. Prepare these things. You have a 10 o'clock appointment that needs kaza. Go to the lab and get. You have an 11 o'clock appointment that needs kaza. Do it. So prepare what you have to do for the whole day. If you are prepared, the doctors won't have any issue. They'll say they do what is expected of them to do. It's part of your job. Okay? What else? Dr. Sal?
Yeah, it's funny, sometimes when you see everything 100% ready, you start to look at your assistant like, what's up today,
Well, that's part of what this is my hope for when I ask you next time I come. Dr. Salim, Dr. Asma, Dr. Ammar, how are things in the environment of the clinic? Are they did the training do any good? Have they changed? Have you felt any change? Both sides, the nurses and the doctors. Now, this is another thing. Let's ask the nurses, what don't you like from the doctors in the clinic? We have to ask them. Yes? And speak up. Yes, don't mumble inside you like Dr. Hussein.
Apparently, you guys are not punctual and you have things missing.
Okay, yes, this is yes.
No one's being
Yes.
nice.
No,
to you.
nobody. We're not accusing anyone of anything. We're just lay things on the table, and when we lay things on the table, we put the cards right in the right order, so we do our work right. Okay, it's about time. We've been here for some time. Now there are issues. Nobody is perfect. God is perfection. Nobody is perfect, but we expect to be at least somewhat perfect. Okay. If anyone asks me, are you perfect in your job? I'll say, no, I'm not perfect. Someone else from his perspective will say, oh, she's excellent. No, I'm not excellent. Whoever gives himself an excellent grade is a hypocrite, actually. Because whoever thinks he's excellent, there is someone excellent than you. Got it. Okay? So please, lay out the table, tell us, what don't you like from the doctors? Ibrahim, yal, tiji.
Before that, can I say something?
Yes, say please.
Before we talked about what we are not like about them, we mentioned things that the things that make the doctor angry is not speaking the same language or not being ready. So if you can give them examples of how usually a nurse would not like a doctor, maybe they can choose.
Maybe
it.
they can relate to it, like.
Yes.
Okay, so it's an
Make it easier.
What have you heard as an
What
answer
would
to this
something
question?
make them not like a doctor?
Okay.
I think maybe respect.
Yes. Yes, believe it or not, there was a survey, there was a paper published asking nurses, dental nurses, if we put, they put certain characters like respect, punctuality, friendly, empathy, compassion, lots of characters. And they asked the nurses, what would be number one that you want from the doctor in the dental clinic? They said respect. They all asked for respect. So, the mic is with you guys. What would you want from the doctor?
I think I don't think you'd get honest answers at this moment.
Why? Because you're here?
Because all of us are here, and we each nurse is assigned to one doctor, so whoever speaks up will be directly. I don't think we're ready for that yet.
For that yet?
Face-to-face
Really?
confrontation.
I can ask a question.
No,
I can
why?
ask a question in a different way.
Wait, ask them.
So for minors,
Yes.
Well, be honest.
Oh my god.
What would you change about me?
It's difficult.
لا عادي والله عادي.
Yalla change, yalla change.
What would you change about me? What would you feel that it's better to be changed
for him
about
to
me?
change?
Maybe to cough less?
What?
To cough less.
Cough less. Oh, you have a coughing issue? Maybe it's like something in his throat. It's okay. Sometimes if we don't have something hot to clear up the airway passage, that's something acceptable. يعني عادي.
Nothing, doctor.
Nothing, doctor.
Perfect, yeah.
He's perfect. Then what would you like to change in her? Oh.
Yeah,
She knows.
La, I want to know. I want to know. So next time I meet you, I'll ask if she's changed or not. Come on, be honest.
Well, actually, to be honest, I think this is mostly about.
We know about the language part. خلاص, يعني she's not going to talk in her native language again.
Mostly, to be honest, it's mostly about us educating them, because when usually we spend more time into educating them, they usually most likely they will get better.
Okay.
So شوي لفيت صح؟
But this is talking.
So I mean, yeah.
I want her direct to her. What do you want?
Some flaws, but when I talk to her seriously about them, she works.
So why don't you, at the end of the day, collect all the remarks you have for your nurse and sit down with her for 10 minutes before you leave this clinic and tell her you did this morning something wrong in the afternoon you did with the patient. Remember, you didn't do kaza. I expected you to do this. Because when you tell her today and then tomorrow and then the day after, you've been saying it for the whole week. If she doesn't get it the first time, maybe she'll get it the second time. If she doesn't get it the second time, maybe she'll get it the third time. Hopefully, by when you keep telling her till the end of the month, she'll get it. but I don't think she's يعني that she's that level of that she won't get it from the first time, right? No, it's not about. Hey, this is not a personal issue. This is another thing we want to talk about. Don't take things personally. When we say something, it's something major. It could be in anyone, even the doctors. Okay, we said the same thing. If مثلا Dr. Salim and Dr. Ammar is talking in Arabic, maybe you're offended. Maybe you think this is irrespectable of your presence. All right. So this is it comes back to us also. This language that we're talking about. So returning back, punctuality. You understand now what punctuality means? Tell me what punctuality means.
Be on time and prepared everything.
Prepare everything. What does mean prepare everything?
For me, because usually I'm always early comer. To prepare.
Leave the early coming. What do it mean prepare everything?
The patient's case, all the things need to prepare.
The first patient or the whole day? The whole day. A whole day.
We use a terminology, Gerline. What is the terminology that we use for prepare?
This is what I was going to say. We've been talking about this for the past quarter.
So we use a specific terminology for preparation. What is the terminology?
Confirmation.
The
No, no,
5
no.
second.
What didn't hear over prepare?
Over prepare.
For every implant case, what do?
Must be over prepared.
What is the definitive example for what
Like
over prepare means?
even this instrument is not going to be used, but must be prepared.
Yes, definitely. Yani make preparations even if something is not going to be used because you don't know. Maybe Dr. Hussein will use it. Don't let Dr. Hussein at a certain time come and say, "Why isn't there kaza? Why isn't?" You know, this would make him frustrated. He's already under tension because he has to be focused on the treatment. So don't let him deviate or put him in another direction because something you failed to do. You have to be fully prepared. Okay? And when I say fully prepared, everything for each patient during the whole day course. Don't wait for to see who's coming next or come to the reception. Who's supposed to come? No, you're not supposed. You have a schedule for the whole day. Do everything for the patients. Be prepared. Know everything. Okay? What else?
Doctor,
Yes.
let's go for a communication scenario that I have to fight. I'm sorry. To emphasize over prepare. For every implant case, how many implants I do prepare? For one implant, how many implants I prepare?
How many?
Usually,
Mostly the minimum doctor.
yeah. If I have implant number 13, what should I prepare? Implant number 15 size, 3.1 by 10.
Sizes and also all the things needed like screw and everything.
I mean, extra size for the implant should be there, correct?
Yeah.
Victoria, let's discuss communication at this stage. Doctor, nurse is telling, Doctor, I will be happy from you if you allow me to go only by 66% of my power and you don't shout back. I will consider this a proper communication. Okay, but patient will be angry, patient will be not satisfied. Let's hide this secret together. How you describe this communication level?
This is conflict issue that we'll be talking about tomorrow.
The conflict.
Yes.
Exactly.
Conflict tomorrow. Yes. Yes.
Thank you.
We have scenarios for conflict.
This is a conflict.
Yes. So we don't want this to happen in front of the patient. Yes. Patients, if he feels that there's something wrong or there's a miscommunication between the doctor and his assistant, the doctor and his nurse, the patient will be tense, won't be happy, might feel there's a problem in the clinic, will send bad messages over the social media that these people, they're not, it's not a friendly atmosphere. It's a holistic, the hostile atmosphere. No, I don't like this area. No, we don't want this. This is a very issue. Yes, Ibrahim, you were saying something.
Coming again.
Yes, he won't be coming again, and we don't want this, of course, definitely. So respect, punctual, be prepared. What else do we want to add to our list? to finalize our talk. Use, speak up. Yes, speak up. Well, this is an issue we didn't speak about. Speak up. You made a mistake. You didn't do something. There's something we forget. We sometimes some of us feel that the word sorry is a bad word. And when we apologize, this is something bad.
In Arabic culture, yes.
Yes, يعني I always say I'm sorry. I admitting your mistakes is very important. You've done a mistake. Admit it. Why keep it from Dr. Ammar or Dr. Salim, Dr. Hussein or Dr. Asma until they discover it? And maybe when they discover it would be too late to remedy. You have to speak up immediately and say, sorry, doctor, I forgot to do so and so. Sorry, doctor, I didn't know that you wanted to do this. These are very important things. You have to speak up and say what's on you, what happened. Say Dr. Ammar confronted one of you with an issue, and he wants you to answer back. You have to say it. I asked a question from a little while, and this is not the place for being shy. Because it's not a matter, it's not a personal matter. It's not something, it's not you. This is the clinic. We are talking about this success of this practice. This clinic has to be successful. In order to be successful, you have to be communicating properly with each other. Okay? So when he asks you something and you're afraid to answer. You are afraid of, he looks aggressive maybe.
I'm actually the nicest doctor here.
Maybe it's your mustache.
That's why you think they're scared of me.
No, Dr. Asma is
You think they're scared of me.
Who is the scariest doctor of them? They all look at you. Okay, other than Dr. Hussein, who is the scariest?
Guilty as charged.
Yes. Well, he's the boss. He has to put a scary face. No, the three doctors are with us. Come on. I already know who is the kindest.
It's still me.
We said whoever admits he's something, he's not.
I'm not the kindest in the room.
No, if we're talking about relationships, we have to create a very friendly and not friendship, friendly atmosphere. Friendly atmosphere makes the patient comfortable, makes him at ease, not tense. Okay? هو انتم مش عاملين ميوزك ليه؟
For you, doctor, you have this.
لا جوه الكلينكس. Yes, I didn't hear. أصلا ما سمعتش. Yes, these things make the patient feel at ease. Believe it or not, going to the dentist clinic is not like going to the doctor. Doctor, if we go to the doctor, the stethoscope, okay, take so and so and so and so. خلاص. But opening the mouth, putting a suction, putting the rubber dam, blood and saliva and suction, and Allahu A'lam what they're doing actually inside my mouth. Maybe they're cutting my tongue. I don't know. What are they doing?
Patients are a standard. They're anxious.
Yes.
Standard.
Yes. Sometimes we might have to sedate a patient. Might give him some sort of sedation before he comes. But if we diagnose the patient, he's a kind of a patient that's going to be anxious, and maybe we might tell the mother or the father or the husband or wife, please give your wife before she comes so and so that she'll be relaxed while sitting on the chair. Okay, because we don't want the patient doing like this. It could happen. Yes. After she all of a sudden she decides, no, I don't want to be treated. I want to go. I want to leave. I'm not happy. I changed my mind. It could happen. So what makes the patient do like this? If she finds the surrounding around her not happy. That's why we said in the middle of the pyramid, communication skills, if we remove it, like, there's this game that has the blocks and we remove the blocks. Can you believe? Yes. If we remove this block, the communication skills, the management will drop. And the ROI. Okay? So we don't want that. Because believe it or not, the success of the practice is your accomplishment. All together. Okay? What else would we want to add to the list? Speak up, respect, punctual, be prepared, speak up. Huh? What else? Be professional. Thank you very much. Yes, and being professional means, it means?
Don't speak native language.
Yes, don't speak in a different language. Speak in the English, because universal language. Be professional. Know what's your job. Your job. You're not the dentist, you're the assistant. So know your place, know what's expected of you to be doing at what time. Okay? Sequence 1, 2, 3, 4. Dr. Asma trained you, you know now. She doesn't have to tell you every day you have to do this and do this and do this and do this. You've been trained properly. You know the patient is coming, they're going to be doing something, so you're ready. Okay? What else do you want to You tell me, you guys. Huh? Tell me something. I want to hear your voice. The tone of voice inside the clinic, how is it supposed to be? Tone, the voice itself. Dr. Ammar is talking, Dr. Salim is talking, you're talking. How is it supposed to be?
Not loud.
Not loud, yes. We're not shouting. But we have a patient that has a problem. We were talking this morning about patients having physical problems like hearing impairment, hearing problems. Now, some patients, they don't like to admit that they have a hearing problem. I know for a fact my sister has a hearing problem and she doesn't like anyone to know that, okay? She doesn't like always say, huh, what did you say? Huh, what did you say? Huh, what did you say? This is a problem. It makes her itchy. It makes her psychologically disturbed. It makes a lot of problems happen because of this problem, okay? So if you speak in a low tone, and you know that your patient has hearing impairment, what do you think the patient will feel? You're talking about her or talking about him. So if you know that the patient has a hearing problem, speak up. Let your tone of voice a little bit higher, not shouting, because shouting for patients with hearing problems sounds like shh. But they want the pitch like I'm talking. This is the pitch that they want to hear. This is the pitch that they want to hear. Dr. Salim, do you want kaza? Yes. Dr. Asma, do you want kaza? Yes. This is the point. Like in, Dr. Salim, oh, they're talking about me. Something's wrong. My case, I have cancer. He has a red swelling inside, and Dr. Ammar is going to take a biopsy to go to a lab. He's going to die. She's going to prepare her will. All these are going in her mind now because you're talking in a voice that she doesn't hear. Okay, so respect. This respect. We return back to respect. That's why when I told you the paper that was done on dental nurse and dentist in the dental environment, they all agreed respect. Respect each other, respect the patient, and respect the patient's physical condition. One of the physical condition is hearing. Okay? So no shouting and no low tone voice so that the patient doesn't hear, especially with patients you already in fact know that he has or she has a hearing problem. Yes?
Most of the time happens, doctor, when I ask for something extra, the preparation. Like I have some bleeding, so I ask for additional needle holder or additional thing. The implant is not a good position, very technical. Then the nurses, they try to help me, but in a way that I feel the patient will be obsessed. Yeah, it makes that, so the patient, it looks like something happened, but what happened, it's gonna be okay. Okay, please bring me the second needle holder from the third floor. So he will assume that this is something additional,
yes,
okay.
Yes.
But the tone of speaking loud, many times I get, what are you saying? yeah, I'm just asking her to. I'm keep insisting to make her voice
Yes.
loud.
This is
I'm
what.
bringing. Say, yeah,
Yes.
doctor, I'm letting her to bring the.
What
blood
happens
from-
inside the clinic, the patient is like a radar.
Yes, yes.
He's like a radar. His eyes is going like this. He might be opening his mouth like this because you're putting him in this, but his eyes are like this, 360 degrees, like this. Oh my goodness, what are they doing? Oh my, they're going to kill me.
Yes, at 2 days I was a patient.
She wants to feel safe. Safety comes from you together, doctor, nurse. Be prepared, doctor. You shouldn't tell her another needle holder. When we say be prepared with extras. Something that hasn't been used can go back. But the bad thing is not to be fully prepared. Okay? Don't give a chance for the doctor. Like Dr. Salam said, if I come and find everything prepared, I'd say something's wrong. She woke up on the wrong side today. Give them let's see. Let's for 1 week try to have a response that the doctors are what? They're all prepared. Wow. They're all doing everything right. There's something wrong. It's the end of the world. No. We're all going to die next week because you're doing something right. Okay? Please. Now you remember. Okay. Be professional. Do you want to add anything on this list? Mario, you didn't say anything.
I think it's all there.
It's all there?
It's the package of respect, punctual, prepared, speak up. It's the being professional.
You don't want to add anything? You didn't say anything.
I said be prepared.
Be prepared. You said be prepared. You said what? What did you say?
I come in peace.
What did you say? You didn't say. Well, someone said something. Focus. Yes. Focus. No, there's something you didn't say. We said and you didn't put it. That means you weren't listening.
But I think maybe this goes under a professional,
No.
Not listening. I'm talking about what I'm going to say. Look good.
Yes, going to mention. Call it
Look professional.
hygiene, personal hygiene. Or
This is another issue. This is another issue. Another training session. This is something. Yes, being clean, being looking clean. Smelling clean. Yes, this is because don't forget that the patient is in between and you're very close. So if he gets irritated by the odors that's coming out of the doctor and the nurse, he won't come back. And he'll write it on social media. And it will be bad for the publicity of this clinic. That the doctors and the nurses, they don't look nice, they're not clean, and they don't smell nice. This is very offending, okay? And
for embarrassing, but even they don't write it on social media, they don't come. 2 things to grasp. Of course, it's 1 hour lecture with Miss Hera. But as a patient, what catches the patient, of course, regarding the additional to the smell, which is we don't have. I don't know. I want to be racist. But usually Indians with halba. I don't know what is halba.
Spice.
yes. Yes, I know.
We
Yes.
don't have this problem.
Yes.
Here.
I know this.
Some joke from a patient. He looked to the mustache of the nurse, of the lady nurse, and nostril hair of the lady of the doctor male.
Yes.
So this is how meticulous.
Because
Any regular
guys,
patient
come on,
sees
put
that.
yourself in the patient's shoes. You're like that, and this is the doctor and this is the nurse. So what are you going to do for the next hour? Doing nothing except looking at them. Her eyebrows need to be done. she needs to. Yes, come on.
How did you like my clinic? Yes, Nurse has a nice mustache. I'm not talking about my clinic.
Yes, so we're talking about, yes, personal hygiene and personal looks. We don't mean to put on full makeup, but we mean to look professional, look pleasant. We're not running for Miss Universe pageant or being a model. Huh? No, we just want to be looking really ready for the patient. You're wearing your head, you're wearing your mask, you're wearing the goggles, so what the patient can't see anything actually. Okay, so this, I don't know how did he see the mustache. if it's covered.
Nurses are lazy to do.
Yes.
with the mask.
Now this is another issue. When you're wearing the mask, actually doing like this,
Wear the mask.
this is not wearing the mask. Okay, when you drop it under your nose, you're protecting yourself and not protecting others, because your nose is releasing things. So in the air, okay. When we have a mask, we're doing like this. Your nose and your mouth obstructed by this mask. So you're protecting yourself and protecting others. I see this. Yes, this is.
Like an uncourtesy message.
Yes,
by the way.
yes, this
Either
is-
you don't wear it,
Yes, yes.
or if you wear it, you wear
Yes.
it properly.
Wearing the mask, you wear it properly. Yes, yes. And the nose, like Dr. Asma has it, this part that is like
For the fogging.
yes, it has to be tightly, because if you leave it open like this, this is also the air coming out of your nose will come out and spread in the surrounding air. ده كان issue آخر يعني بس يعني by the way if we're talking about yes.
Professionalism.
So active listening, this is very important لأنها جاية بعد focus will come if you're actively listening. Okay, please be active listeners. على فكرة في تعمل يعني في session اسمها active listening, ويمكن احنا we tried to do something like this, an activity last time when we met, and when we remember Algin got out and he said a word and whispered the word, so everyone was listening until we got another word and it was not said. Okay, this is listening. When someone is talking to you, listen even the words that are coming out of his mouth. If you don't hear, if you don't understand something, this is another thing. Maybe some of the things that Dr. Salim is saying you don't understand. Tell him, Dr. Salim, I don't understand what you're saying. But don't keep saying and go out, I don't understand what he wants. So he doesn't want nodding. He wants you to understand. So Dr. Salim, when you say something to any one of them, do they all understand what you want?
What I want?
Yes? Do you get the feeling that they understand?
70-80%.
So how can you test that they understand? No, we have to do this as an activity. Now, you are asking someone to do something and she says, okay, yes, doctor, I will do this. How can she, this is how she is responding. Yes, doctor, I will do this. How can you make sure that she really understands and she will do this?
When I audit later, I will find that it's different than what I asked.
Dr. Asma, what will you do?
How to ensure that the communication is reached.
Yani, you
I
told
don't know what to do. Sometimes there's messages like
No. Ibrahim, I'm telling him to do something, so and so and so.
Yes,
And
I'll
said,
give you an
yes,
example. I'll give you
Ibrahim,
an
yes.
example.
Uh-huh.
I'm using with nitrous oxide,
Uh-huh.
blue and green.
Uh-huh.
Blue and green.
Okay.
Blue nitrous, green oxygen.
Mm-hmm.
Okay. Kindly close the blue, open the green.
Mhm.
I'm finished. Close the blue, open the green.
Okay.
Yes, doctor. I'm pushing up the blue up. Kindly close the blue, open the green. Close the nitrous, open the oxygen.
1 plus
Yes,
1
yes,
equals
doctor. And he's pushing the nitrous up and up and up. So how this will go under communication? I said only
Before-
open
before-
the blue,
before-
close the green. the
Before they do anything, ask them, what does blue mean and what does green mean?
green. I know this guy here.
Now this is what the activity was now. Ibrahim, I'm asking you, just ask regular things you ask in the clinic from your nurse.
This
Yes.
is a true example.
Yes.
خلاص,
La. Salim, ask anything you can ask Ibrahim. Yes. Give him a.
Please, we don't forget blah blah blah. Please write it down so we will not forget.
Okay, so Ibrahim says,
Yes,
Not written, not done.
Yes.
if I did this wrong again, it should be didn't listen for doctor or.
no. Your answer now, you're answering. Dr. Salim is telling you to do this. So what's your response to him?
شطب عليك يا معلم كده.
بص له. Look at him and respond. In the clinic, you're in the clinic. You're not with us.
Yes.
Yeah. So what will you respond to him?
Okay, if I understand this word.
Ibrahim, answer back to Dr. Salim in words. Look at him and answer. Say
Yes, doctor.
basket. Okay. This is till now. You have asked something. You responded, and he doesn't do it.
Yes.
So what's the problem? You have to make sure that he understands what you want from him. So instead of asking him, Ibrahim, do so and so and so, and he says, okay, after that tell him, what did I want? Or what do I want from you?
Good question.
So he'll have to say, you want me to do so and so and so and so. By doing this little reassurance or this little activity, he will do it because it's a two-way. Remember communication, sending, receiving, and then sending back. By asking him the question again in another way, he'll respond. He'll have to not just nod and say, okay. He'll have to say in words, you want me to do so and so and so and so, a doctor? You'll say yes.
By the way, we already do that in real life.
Hmm?
When we give a big order to a restaurant, please repeat my order.
طب why do you do it in the restaurant and don't do it here?
Because of the noise. You said that.
No. We were in a restaurant and nobody is except us. and I say, please tell me what I ordered. You ordered 2 hamburgers, one with lettuce and one without the mayonnaise, and keep off the Yes, right, exactly. That's what I want. Okay? So yes, you have to confirm. Confirmation is very important. Even if it's a little task. Even if you believe.
So we have to put, please repeat my order.
Yes.
to fit not only
Confirm.
my words or my stuff. Sometimes you said that the transmitter and receiving and message and noise. There's noise.
Yes.
It's very clear that referral. We have to add, okay, burger with lettuce, burger with mayonnaise.
Well,
looks like a little bit.
So
noisy.
why are
Doing referral looks like the sky is
why,
clear.
Dr. Hussein, so why are there discrepancies in management as regards referrals, as regards as regards next appointment, as regards certain incidents? Why? Because there's lack of communication between the doctor and the nurse.
Okay, not defending Dr. Salim or Dr.
No, we're not.
Kindly make the referral looks like a clear sky, and the referral is a
All it
button to
takes is reassurance and confirming that his order that he asked from whoever has been confirmed in the brain cells, and in order to take it out of the brain cells, he has to repeat it with his tongue and say it. Yes, I understand, doctor. You want me to do so and so and so and so. I will do it. Bas. By doing this little activity, he will have to do it. If he doesn't, well, then you can do whatever you want to do with your IR and your other things that you do. Okay, this is it. Okay, yes, it's a two-way street. It's not Dr. Salim giving orders and you accepting the order. You have to tell him, you are asking me to do so and so and so. Yes. By doing this, you are confirming the task you are supposed to be doing. Okay? Do you understand, كلكم? You understand what we are talking about? This issue. This is a very important issue because this is something I observed by just sitting and in the meetings and looking at what's going on. I have observed that some of the problems lie in I won't say being lazy, but you postpone things, and usually a person, when he postpones things, it accumulates, and once you accumulate responsibilities, eventually they accumulate and accumulate and accumulate and accumulate, and you find, wow, I'm going to do all this this at once. No. I'll postpone it all for tomorrow. And when tomorrow comes, it comes with its responsibilities. So you have, at the end of the week, a lot of tackle to hassle. Please, 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 don't postpone anything. As you're being asked to do something, do it immediately, because there must be some time. And I also, being in that room, I see the camera and I see some of you doing nothing. So why don't you use this fruitful time and do what you're supposed to be doing? Instead of having incidents and bar charts displayed with problems in referrals, problems in next time appointment, in lab didn't bring the lab or didn't tell the lab to do something because we have tomorrow an appointment to deliver something to the patient. I am an observer. I have been sitting in a room and just looking and seeing and observing what's going on and what's being managed wrong. So I'm telling you, these are problems very easily you can just with a little way do it and solve it, and it won't be a problem anymore, and it will be part of your daily routine, believe it or not. Okay, Dr. Hussein, what do you want to add for this doctor and nurse relationship?
Just if we do half of this, I'll be happy.
No, they're going to do it all. Let's repeat together. I respect. Come on. I respect. I will be punctual. I will be prepared. I will speak up. I will speak up. You speak up. I will be professional in every way, in every manner. Be professional. Wear your mask properly. Wear your whatever, be prepared so that the patient doesn't look to you and say, ooh, what this, don't do this. I will focus. I will be active listener. When we say be prepared, what do we mean by be prepared? Over prepared. Be over prepared. Don't give a chance for Dr. Ammar, or Dr. Asma, or Dr. Salim, or even Dr. Hussein say, Ida, why didn't they bring kaza? Why didn't they put... don't. Okay? And try to read the body language of your doctors. Try to learn what they mean by certain... Like I told you, the singer, the famous singer, she does like this. The orchestra behind her knows that this means repeat. Don't let Dr. Asma say, don't. You can do it, okay? خلاص?